lumbar spine, back history. These are the questions we ask, and this gives us an idea as to what's causing your problem and how we may be able to help. We start with your age, your height, your weight. Do you smoke? Then we want to know if you ever had surgery for this condition before. If you did, when was it? And did you get a pain-free interval from the surgery? How long did the surgery help you for? Your current pain, how long have you had this pain for? Then we want to rate the pain 1 out of 10. And 10 is agony. You can't even imagine a 10. 5 is legitimate moderate pain. So tell us what number your pain is. We want to know at its worst, how bad does it get? We also want to know just on a constant basis, what's the baseline pain you live with every day? Then we want to know the back pain versus the leg pain. Back pain is more indicative of arthritic degenerative pain. Leg pain is more indicative of nerve pain. Most people have a bit of both, so it may be 50-50, back and leg. We do the back first, then the leg. Maybe you have 80% back pain and only 20% leg pain, or maybe you mainly have nerve pain, like 30% back and 70% leg. So tell us that ratio. And then we want to know with your leg pain, which leg does it go in? The right or the left or both? We do the right one first, then the left. Is it 50-50? Is it 80% right, 20% left, or 10% right and 90% left? Then we want to know where in the leg do you get the pain, because the nerve comes out and goes down your leg, and that tells us which nerve may be affected based on where the pain goes. So the L2 nerve stays up in your groin. The L3 nerve goes into your groin in the front of your thigh, but L3 does not go below the knee. The L4 nerve also goes in the front of your thigh, but it can cross the knee and go to the medial inside part of your lower leg, the inside part of your calf. The L5 nerve goes into your butt, the back of your hamstring. It can come around to the side of your hamstring and the side of your thigh. And then below the knee, it goes to the outer part, the lateral part of your lower leg, the outside part of your calf. Then it goes to the top of the foot and to the big toe. So tell us where the pain goes. That can tell us, is it the L5 nerve? The S1 nerve stays in the butt, back of the hamstring, the back of the thigh. Below the knee, it stays in the calf, in the back of the calf, the posterior aspect of the lower leg. So tell us where the pain goes. That indicates what nerve may be affected. Then we want to know which activities make the pain worse. Does sitting, standing, or walking? And if it does, how long can you do those activities before the pain makes you want to change position? If it's sitting, a lot of times that's from degenerative disc disease or a herniated disc and discogenic pain. If it's standing, a lot of times that's from stenosis, pinching the nerves. So if you stand and it starts to feel painful and you bend forward or you sit down and it goes away, that can be indicative of stenosis. Then we also want to know, does this pain wake you up in the middle of the night? That can be indicative of a tumor or cancer in the spine. That's different than, do you wake up in the morning stiff and in pain? That's more indicative of arthritis and degeneration. So you wake up stiff and in pain, and then after you walk around or take a hot shower, 20-30 minutes may loosen up. That may be arthritic pain. Then we also want to know, do you get numbness in your legs? And which leg do you get it? And where does the numbness go? Because again, that tells us what nerve may be affected. If it's in the front of the thigh, it can be L3 or L4. If it goes from the front of the thigh across the knee to the inside medial aspect of your calf, maybe L4. If it goes from your butt down the back of your hamstring to the side of your hamstring, to the side of your lower leg, to the top of your foot, to your big toe, maybe the L5 nerve. If it stays in your butt, the back of the hamstring, back of the calf, it may be S1. Then we want to know, do you have weakness in your legs, and which leg, and what muscles are weak? Your hip flexor, flexing your hip up, is typically L2 and L3 nerves. Your quadricep, your thigh strength, when you put weight on your leg, like going downstairs and you're balancing on that one leg, that's typically L3 and L4 nerves to the quadricep muscle, some L2 as well. The L4 nerve can also cause that thigh weakness with a bit of a foot drop, where your ankle dorsiflexion, extending your ankle up, can slap down when you walk. If that's weak with your thigh, it can be L4 together. The L5 nerve goes into your hip abductor, your gluteus muscle. So when you stand on one leg and you try and balance, your body can drop down because the butt muscle doesn't get tight and hold you up. So if you're unstable, that can be the L5 nerve. The L5 nerve also goes down the leg, and it does pulling your ankle up. It mainly does the dorsiflexion, the extension of your ankle, pulling your foot up. And if that's weak, you'll get a foot drop where you can't walk on your heels because your foot slaps down. If you wear a heavy shoe, your foot may slap down. You kind of feel slap when you walk. And you may catch your toe as you're walking, you may fall from it. The L5 nerve also goes to pulling your big toe up, extension of your big toe, your EHL. That's all L5. And then the S1 nerve goes to your calf. So your gastrosoleus muscle, standing on your toes, tippy toes, on just one leg, stand on the leg, go up on your tippy toes. If the calf is weak, then it can be from the S1 nerve. So we want to know which muscle is affected, which one's weak, and which side, which leg. Then we also want to know, do you have bowel or bladder problems? Any history of incontinence, hesitancy, dripping, or frequency. Incontinence means you lose control. Hesitancy means you can't quite get it started. Dripping means you drip afterwards. And frequency means you have to go very often. So from that history and those questions, that tells us a lot about what's your problem. Is it mainly arthritic pain or nerve pain? And do you have a neurologic deficit? So you can fill out the form and then please submit it to us. Email us at info@watkinsspine.com and we can get back to you. The other option is if you already have a diagnosis, you can move on to the videos that correspond with each diagnosis. Thank you.